Tap, tap. By far, the most stressful thing about this is the technical aspect. Neither myself or Dr. Shah are like very technologically savvy. And so we spend a good amount of time just trying to get the cameras right. All right. Let's make sure the audio sounds good. 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 I think it sounds all right. I think it sounds all right. Yeah, I think we're good to go. Okay. Let's see here. Let me do this. Copy the link. Throw it up on Instagram. Link. Paste. Done. All right. Okay, we made it. All right, excellent. Canada, Serbia, Kuwait. Wow, I see it. Malaysia. I love this. This is one of the favorite things I think about the YouTube channel that Dr. Shah and I just both appreciate so much is we just get to interact with so many people from just so many different places. And you know, Dr. Shah, his family's from Pakistan, mine's from Indonesia, and we've always just had so much appreciation from everything that all these different cultures bring, and the knowledge bases. Just such a cool global perspective. It just blows my mind. Switzerland, hi, Germany, love it. Tunisia, Nepal. Oh, Nepal, that is a hidden gem of food. I've only had one occasion to try that in my life. California, I have a lot of family there. All right, so let's get started here. I had a few topics in mind, but I saw some good questions here earlier that people had kind of logged at the beginning, so we can start there. First off, also, thanks for coming in Thursday at lunchish, brunchish, depending on where you live, and hopefully you're all able to sneak away from work or watch remotely while you work at home. We're going to do this, probably try to do consistently in the middle of the week, either at lunch or in the evenings. We'll find out what works best with our schedules and our clinic schedules. All right. One of the questions I saw, though, that I did want to address, we have a couple questions early on about hormonal acne. And we talk about this a lot, but we never dedicate a ton of specific attention to it. And the reason is when it comes to over-the-counter options, you're super limited. And that's super frustrating. But the reason is because this is not only your normal hormones, like the ones that cause and contribute to everybody's acne, but you also have like additional hormones, especially in your 20s and 30s, that can cause acne in people who have never even had acne before. These lesions tend to be more cystic and deeper. So not only are your hormones contributing, but also the lesions often are deeper and don't penetrate or are not penetrated by topicals. And so medications from the inside out are usually the most effective way to get to this. It is what it is. The normal topical ingredients for acne work here too. But then you have medications like spironolactone. And that's what one of these questions was geared towards. How does it work? Well, it actually doesn't change your hormone levels that much. It's an anti-androgen, and it can blunt those masculinating hormones on the androgen receptor, which can cause acne. Now, it works pretty darn well, especially for the lesions here on the jaw. There's been a lot of studies that say it's as effective as oral antibiotics. Then someone asked here, do you need to check potassium? Because this used to be a blood pressure pill, and it does cause some potassium retention or reabsorption from your kidneys. And the answer really is, it's up to your doctor and their relationship with you. We have a lot of good data showing that people who don't have any previous health conditions, you don't really need to check labs or even blood pressure because we use a lower dose and it's pretty darn safe. But again, it's absolutely reasonable depending on what other conditions you have or your dermatologist experience with this to get labs if need be, but there's a good chance you may not need them. Now, let's see here. Dry sensitive. All right, so from Sumia G2, hi doctor, I have combo skin and dry sensitive skin. Is La Roche-Posay Toleriane Ultra Cream good for me or CeraVe Daily Lotion? So I feel like we're going to be talking about this more. And I did reply to a comment on our last video that we are going to be talking about how to winterize your skin here. And a part of this is talking about lotions, creams, ointments. So both of these are good moisturizers. Like the CeraVe Daily Lotion, I use on my face, maybe in the summer. And so it totally depends on you and your climate and your skin. So if you have drier skin, you don't have, like if you wake up and your skin is just very dry, or you notice it's dry throughout the day, the La Roche-Posay Toleriane Ultra for me is great for the face. The CeraVe Daily Lotion may not be enough, especially for the body. Even though it's great ingredients, the vehicle is more watery. So it all depends on you. Both are great. For drier skin, I tend to prefer creams. For more oily skin, I kind of actually have oily skin on my face. I don't think we've ever said that or I've ever talked about that on video, but especially with my central face, I have a lot of oil glands. And so that's why I like lotions for the face, a little bit more water-based, but either one can work, just highly individualized. Another one from Mohammed Sadiq, can I use salicylic acid face wash and apply azelaic acid cream? So the answer almost always with this like ingredient layering, ingredient mixing is yes. Like we go through this so many times, and there's not a lot of true science behind it, especially when you get outside of like super oily ointment, which would block other things from coming in versus just active serums or active ingredients. So you can use both of these ingredients. In fact, salicylic acid is great as a face wash. I almost prefer it that way as far as ingredients go, especially for acne, because it does its job. It removes the oils, resets your skin, and then you can use like azelaic acid thereafter. In this case, probably for acne or hyperpigmentation. No problems. Irritation is just the threshold that you always have to look out for with most of these ingredients. Okay. So this one is from Ivana T. Can I put Vaseline over Adapylene? And this is such a good question. The reason is like we talked about a long time ago using moisturizers before, during, and after using your retinoids. And Vaseline is like a very occlusive ointment, right? And so in theory, it can lock in the moisture after your skin is already damp and provide you like a good moisturizing sensation, moisturizing effect. But when you put it over potentially irritating ingredients like adapalene, it also occludes them. And it can make them a lot more effective. We know this from topical steroids. If you occlude topical steroids, it can make them up to 1,000 times more potent. So in general, I would recommend not to apply a layer of Vaseline directly over like a retinoid or other irritating ingredient, because you can make it just much more effective. Now, if you let the retinoid sit dry for like 20, 30 minutes is sometimes what people say, and then you apply Vaseline over your moisturizer to lock that in even more, probably not as much of an effect, but in general, I would stay away from that. From Lego Creator 2169, how was my day? It's good. I got a little stressed out with the camera and the cords, but that's nothing new. Jameson Griffith, don't forget who won in Topgolf. Yes, I remember. It's my friend from a close friend of ours in Tennessee. And yes, Topgolf is extremely fun, and it is not something I'm good at. But even if you don't like golf, it's worth going. Okay, there is these. We have a couple questions here also about shrinking pores. I have a child who has large pores. This is always one of the most discouraging things to talk about, and I hate to start it off that way, but it's all about setting expectations. One of the things that I think people miss with pores in general is that you have the open portion of the pore, which is what draws our attention to it, right? And that's kind of where the oil gland opens up to the surface. But for us, everything for me is like microscope first. There's just like huge structural support around it, which gives the open pore its body. And that's what's the most difficult thing to treat. Like it's actually fairly easy, relatively easy to remove the oil and gunk from the middle of it. But then you're left with this structural thing. And so let's say we remove the oil with the salicylic acid wash. We decrease the oil production with niacinamide. We decrease the oil production and increase in skin cell turnover with retinoids. All of those are going to help, especially help with keeping that sebum, the nasty sebum that everyone loves to put videos out there of people squeezing. It helps remove that and prevent that from building up. But the hardest part is getting to restructure those open pore structures. And that's where things like heavier exfoliants, peels, all of that can be beneficial. And retinoids also exfoliate and help there. But even here we get into larger procedures like microneedling and mid-depth peels. Like a lot of in-office things can help a little bit more here, like mid-depth, deep-depth peels, and even CO2 resurfacing. So all that to say, ingredients help with oils. Procedures probably are the most effective thing at actually changing the structure of the pores. But even then, they don't actually all the way go away. Let's see here. Oh, okay. So here's this is an interesting thing. And I get this a lot. So this is from Veronica 575. I use tretinoin 0.05, which is like a middle of the road strength of prescription tretinoin every other day. Would it do any good to use a lesser strength retinol product, like an over-the-counter one, on the off days from the Tret? And you know, in theory, yes, because then you're using a retinoid product every night. I think it gets a little bit complicated though, and I think you'd be better off either turning down that tretinoin prescription to like 0.025 and using it consistently. Just tretinoin has more evidence; it's stronger, it's better studied. Or you can do what we've talked about in our retinol video and mixing it with a moisturizer to dilute it. I'm not a big fan of people having like multiple different types of the same active, either in their skincare regimen or especially prescription. I think it just gets a little bit confusing. And also it may not be the best use of your money because then you end up buying duplicate ingredients when you might be able to make the one you have work either by tweaking the strength or tweaking the product by using some hacks. Can you layer? So Ryan Revels, can you layer with topicals faded? First off, topicals faded. This product we've talked about it every time we talk about hyperpigmentation now because it's like a standalone solo product. It basically has all the complementing ingredients that can be added to your retinoid or hydroquinone based hyperpigmentation treatment. This product just blows my mind. Kudos to them for putting this out there. Can you layer with it? Yes. It's nothing different than any other active. There's nothing in it that precludes it from mixing with other actives. And the only thing again is irritation. So if you find that you're either putting it on damp skin or using it with retinoids and other things that can be irritating, again, it might just be too much. Or you can just mix it with moisturizer and not let it fully dry but while you're using it to offset that. But it can be layered just like anything else. Let's see. So this one, I actually started putting out a video on this, and this one's from Sabia Noor. Are at-home laser hair removals effective enough? And I'd look into this maybe, it might have been a year ago, because we had a lot of questions about this about the same time we did our light video. And there is some evidence that these IPL devices, home IPL devices, can work. It's not great though. I don't love it here. The downside is they're not that effective. And when you get to hair removal, especially with light-based devices, if you use too low of a power, even with the in-office larger machines, you can actually induce the hair to become terminal. So like if you have those like little fine light hairs, especially with lasers, like IPL is actually not a true laser, it's just light. But if you don't have enough fluence or energy, you can actually cause those little hairs to become darker, thicker, and then of course more noticeable. And then you have to treat them with then you would need to follow it up with a more powerful laser, higher energy. So I think they can work. Of course, at home, you have the risk of like burning, irritation, trauma to the skin, which is not really to be underestimated. This happens in professionals' offices often enough. We actually get not a lot, but we do get some people coming in throughout the year where they have been burned by lasers, light devices, and then we kind of just try to help walk them through that and then help the burns to heal without any permanent damage. So can help, not a big fan of it at home. All right, let's see. Oh yeah, okay. So Vandana Jane, how much time does retinol take to clear up acne and start seeing results? Super important question. Super important question, because one of the most common reasons people stop using a retinoid is because they're not seeing results. Other than irritation. There's got to be the main two. And it takes 2 to 3 months with retinoids, retinol, to really get a good idea if it's helping your acne. People do get some sort of benefit within a couple of weeks. It's not like it's just not helping at all, and then all of a sudden in 2 months it's like clear. But it takes 2 to 3 months for the skin kind of to reprogram, and then you'll get an idea of how well it's working for you. And we talked about this before, but that's why we see our patients at 3 months after we start them on an acne regimen, because we want to have an idea, how well is this working for you? Are you 90% better, 95% better? Are you 60% better? And we need to tweak some things. So 2 to 3 months is your expectation for topical retinol retinoids. Okay, Wayne Song. So this one's like almost haunted me. This one is, do you really apply a retinoid 3 times a day? LOL. And actually, no. So I did learn from that. You have to be a little bit more careful when you talk, because I'm just very lighthearted. I joke with Dr. Shaw all the time. And so, it's just like a candid conversation, but on camera. Now, I will say this, though. I do know for a fact that my nose could probably tolerate it without irritation, which is pretty much the main hard stop of why you stop using a retinoid. Here, it would tear my skin up if I really used it that much. Another interesting thing, too, I was watching Dr. Dre's videos because we watch everyone's videos. And she actually did highlight the fact that some of the anti-aging benefits were done using studies of retinoids twice a day. But again, no, I don't. I don't use it 3 times a day. Sorry for disappointing. So hyperpigmented lips. We get this question a lot. It's very difficult to answer. The reason is there's obviously a strong genetic component for this. People go to great lengths to try to treat this hyperpigmentation, including topicals, things that you would use normally for topical hyperpigmentation, retinoids, exfoliants, to something like IV glutathione. It's not very prominent here in the US, but we do see it a lot from the Indian literature. And so all of these things can help. I mean, I'd say it, but the things can help in the skin, can help with the lips, same ingredients, vitamin C, kojic acid, tranexamic acid. But then you get to these things like retinols and exfoliants, and I don't really like these for the lips. The reason is because if we look at, again, under the microscope, the mucosa of the lips, we actually lack something called the stratum corneum. And that's that top layer of skin, especially the mucosal part, where the top layer of skin, where the skin cells kind of are there and provide us this barrier. And so when you start exfoliating the lips, there's not actually as much to exfoliate. You actually immediately get down and turn over the epidermis. And it's much more irritating. There's not really a consistent treatment out there, and that's why we don't really address this a whole lot. Additionally, I know there's a lot of cultural things about it, where some people feel really strongly. Some people really don't feel strongly, really want the skin lightening kind of social things to go away. And so we stay away from that in general, but nothing specifically dedicated to the lips. However, I would avoid exfoliation just given the physiology. Let's see. Oh, ooh, okay. Oh, this one. All right. So this is Mabala Ganinda, sorry. Is tea tree oil good or effective for pimples and acne spots treatment? Thank you, smiley face, green heart, blue heart, all the way from the South Africa. So yes, tea tree oil does have evidence that it can be effective for acne. We did put this up, of course, in our acne ingredients video. It has some randomized controlled trials showing that it can be effective. It has been compared to benzoyl peroxide as a cleanser and is shown to be effective as well. So I like it. It's kind of 3rd or 4th on my list of where I would go as far as using. I think it's best as a cleanser, to be honest, not like a leave-on product because of its irritancy and allergic potential. And also just the ceiling of effectiveness isn't nearly as high as benzoyl peroxide in my mind, just from personal experience, professional experience. But it can work. And tea tree oil is one of my favorite ingredients, though. And it's not because it's the most effective, but it's because it's one of those natural ingredients that actually has evidence. And it really bothers me that there's this whole world of natural or alternative medicine where there's no physiology behind it. There's no evidence behind it. And it doesn't need to be that way. Like green tea, coconut oil, obviously tea tree oil. There are a lot of supposedly natural ingredients that have decent studies behind them. And that's my threshold and expectation for everything. Anything I use, I want to be able to tell you how it works and then how well it works. But at least at least a little bit of science behind it. And that's why I have a lot of respect for tea tree oil. I think it does have a functional role also for dandruff. All right. Vito St. John, does microneedling take fat from the face? I keep reading this. No, it doesn't. Microneedling is something I fall more and more in love with the more and more evidence we have and experience we have with it, because it's safe for all skin tones. It's well studied. It's a very controlled procedure, especially in the office. Like, obviously the skin under our eyes is so much thinner than the skin on our chest, abdomen, or anywhere else in the face. And so we can selectively stimulate the skin, the deeper skin, the dermis in those areas. And it really it is effective at inducing collagen growth, helping with fine lines, wrinkles, and increasing the amount that your medications can be delivered to the deeper portions of the skin. Like for hair loss, one of my favorite studies ever, microneedling and minoxidil or Rogaine in the scalp. Just a beautifully well done study. And they just showed that, again, this helps medications get down deeper. But it really does not significantly cause the disruption and removal of fat. So we do have some things procedurally that have been touted to do that. Kybella is based off of an enzyme from our liver, deoxycholic acid, and it breaks down fat. So you inject that like specifically for submental fat, and it dissolves the fat. And it actually causes a little bit of fibrosis to try to shrink down redundant skin there as well. It works okay. And then we have Coolsculpting, where we use temperature, and then there's actually like thermal, some form of thermolysis where you do other like hotter temperatures to remove fat. And then also there was something called Emsculpt. So I'm going to diverge and talk about something called Emsculpt for a minute. This was like a $300,000 ab machine. And we were fortunate enough to have someone come by the office and show it to us. And it's like, it forces it's okay. You've all seen the belts like that make your abs contract while you're watching TV or anything, but this was like that times a million. And it was supposedly supposed to induce such strong exercise of your muscles that it would cause the fat cells to die and undergo apoptosis. I think that's actually since been redacted and it doesn't do that. And as much as I'd like to have a $300,000 ab machine, we did not buy it, which is probably good. Good for hair thinning. All right, there's a couple here. Let's see. I heard you guys say before that the ordinary caffeine solution with the ECGC was good for hair. Would it be good for hair thinning on the H? Thank you in advance. Now, I don't know where you're talking about putting it, but yes, there is some evidence that caffeine, as well as the ECGC, which is a derivative of green tea, can help with hair. It kind of has the same role in inhibiting the enzyme, that hormonal enzyme that's largely responsible for pattern hair loss. It is not, in my mind, strong enough to be a standalone, in that it wouldn't, like, if I was more aggressively losing my hair, I wouldn't just use that. I don't think it would be enough. And the one thing, though, they're both really mild ingredients, and they come in really nice watery solutions. So they were pretty easy to actually get down to the scalp itself. So yes, they can help. I don't think they're strong enough alone. Let's see. Robin, can you do a video about Finasteride? Yes. And Dr. Shaw and I have talked a long time about how to talk about like a lot of these prescription medications on social media. There's a lot more like red tape about when it comes to this. We just want to make sure we do everything right. Finasteride is something that I actually, well, like we said, we both use it personally. We think that the benefits are absolutely validated. I think the safety is reasonable. This is one of those things, though, that if you do have a history of prostate cancer, you, of course, would need to talk to your dermatologist about and weigh your options here. It may have some other side effects like erectile dysfunction, post-finasteride syndrome. So it's like not completely inert. I think overall, though, like when we generalize things to how well it works for most people, I think it's generally effective and generally safe, but there are always some considerations. And that's the way it is for most prescription medications, because you always have this balance of like the more effective something is, no matter what it does, like everything in this life, if you cause an effect, you're going to have some sort of like opposite effect or some other effect downstream. And so the more effective medicine goes, you are going to have some counter effects, whether good or bad. So this is one of those. I actually did my research in undergraduate on prostate cancer under Dr. Lucia at CU, University of Colorado. And he has published extensively on finasteride. He's definitely one of the leading world authorities on that. Evo Card, thoughts on cetearyl, so cetearyl alcohol for moisturizers for dry acne prone skin. I think it's fine. So this is like one of those alcohols that's like not a stripping alcohol. It has a mildly moisturizing function to it. And so if you see this on an ingredient list, I wouldn't shy away from it. I wouldn't be concerned that it's going to overstrip your skin like denatured alcohol. It can be moisturizing. It's not like a heavy hitter moisturizer like squalane or jojoba oil. I still love jojoba oil, but it can function there as a moisturizer. And for acne prone skin, sure, like it's very lightweight and tends to be very light. Okay, I like this name. Donut Wife 3306. My derm says to not use any actives in skincare during pregnancy and breastfeeding. What is an active and what do you recommend for a pregnancy skincare routine? I currently use Tretinoin for acne. So maybe 3 things for this. 1, you absolutely cannot use Tretinoin or retinoids for acne during pregnancy. Historically, before we had safety on it, people had taken it by mouth and it causes very bad birth defects if taken systemically during pregnancy. And we do know we absorb some of it from topicals. So do not use retinoids during pregnancy. The second thing is I'm not going to contradict your derm no matter what, only because, your dermatologist knows you, he knows your pregnancy, at least a little bit, I hope. He knows your medical history and everything that's going on about you. Whereas I'm just talking about pregnancy in general. So I would never change someone's direct advice to a person. However, when it comes to pregnancy and skin care, I do actually have a video up on my Instagram that I really dedicated a lot of time and a lot of research on the back end going to and putting something out there. It's a longer form video, I don't know, a few minutes or something. And my Instagram is dr.ljmaxfield probably. But I do talk a lot about just what the evidence is, what topicals you use. And the way I think about skincare and pregnancy, I have it as kind of anti-aging, acne, hyperpigmentation, and substitutes. And so just real quickly, let's say we're talking about anti-aging. So for collagen boosting benefits, topical peptides, vitamin C, and niacinamide are generally thought to be safe in pregnancy, and those can replace that effect in retinoids a little bit. And then for acne, you have, again, niacinamide, you have topical antibiotics like erythromycin, clindamycin. Those have been shown to be safe in pregnancy, and azelaic acid also shown to be safe in pregnancy. Bakuchiol is often touted in both of those spaces, not really studied, probably safe, not really studied. And then hyperpigmentation, we have same things, niacinamide, but vitamin C, and then sunscreens. So you can see how, and I think we did this in our last live, how many ingredients it takes to kind of cover what retinols do in skincare during pregnancy. But there are options, and I have that broken down on my Instagram again if you wanted to take a look there. Okay, Tanya Christine, any correlation with diet and acne? And yes, so what we do know for sure is that skim milk can contribute to acne, and high glycemic index foods like simple carbs, things you eat, but break down really quickly, cause an insulin spike, a lot of free sugar, those can contribute to acne. There's some consideration for other things like high amounts of B12, which we in the Western world consume a tremendous amount of B12 from meats and supplements and energy drinks and from Gatorade. It's just everywhere. So that can contribute as well. One of the most important things about this, though, I think, is that, well, yes, if you eat complex carbs and you eat an extremely healthy diet, even low in red meat, it can help your acne get better. But, I do see acne in vegans. I do see acne in extremely healthy people who have extremely, extremely regimented diets. So there's just so much genetics behind this. Unfortunately, it doesn't seem like you can eat your way out of acne, but you can help your acne by eating a little better. Let's see here. I don't think I did. So this is from, sorry, I'm struggling with the name here. Umayma Hechme. Can aloe vera gel replace a moisturizer? So aloe vera is another one of those like plant-based ingredients that actually has a decent amount of research on it. Honey also kind of falls into that category as well. But so aloe vera has been shown that yes, it can help wound healing, which is almost one of like the basic foundational things when you're like talking about something. Can it protect the skin? Well, can it help wound healing? And aloe vera has been shown to be able to do that. Aloe vera also has like this idea that it can soothe things, maybe decrease a little bit of inflammation. And all of this actually makes it a good after sunburn ingredient. And then you talked about the last thing, which is that it's a little bit of a gel. So because it's a gel, it's kind of lightweight. I don't feel like it locks in moisture very effectively. So I like this better as an adjunct. So like an ingredient in addition to like a cream-based moisturizer. So that not only do you get those benefits from the aloe vera, but you also get the moisturizing emollient and occlusive vehicle of a cream or an ointment. I think it functions better that way than as a standalone. All right. Let's see. This is another one that comes up quite a bit. This is from Rabia Kazmi. I do not have irritation from 0.025 tretinoin, which is like the lowest prescription strength nightly. So you're using it every night. That's already as much as you generally need to. Just a bit of flaking. Does that mean I have to increase strengths? So this question in general is like, when do you have to increase strengths of your retinoid? And you actually may not, right? So if you're using this for acne and your acne is well controlled, there's absolutely no reason to increase the strength. You're where you're at. It doesn't matter the strength of what your ingredient is. Just leave it be. If it's working, just leave it alone. For anti-aging, it's a little bit tougher because tretinoin kind of slows the aging process a little bit. It's really hard to appreciate the difference if you're looking at yourself in the mirror every day. So in general, after 3 months of use, if you're using like a low strength retinoid or tretinoin and you're not having any problems or irritation, I think at that point it's reasonable to increase the strength. That makes sense, right? So you really can't quantify like, is this doing everything am I getting everything out of this ingredient that I possibly could? Because it's just so hard to appreciate the differences visually. So if you're not having any problems, yeah, at that point after 3 months, maybe increase the strength for the anti-aging purposes. But again, we do have studies, and I know one of you all had actually sent it to us, sent one of these studies to us too, that topical retinol, which is in my mind much, much weaker than prescription strength tretinoin, it has been shown in the head-to-head that it can help. It can still help to the extent that a prescription retinoid can. Now, anecdotally, I think prescription retinoids work better, and I generally use those myself. I think most doctors, I mean, just anecdotally from who I've met, most doctors do. Just we're comfortable with them. And so we often use prescription strength, but over-the-counter retinols definitely can help too. From Lipo 1, can vitamin C and niacinamide pair together? Yes. So there's a ton of nuance to this. The way they've studied these together is actually very in depth, and that there's a lot of concerns. So if you haven't heard the concerns, can niacinamide inactivate vitamin C? Can vitamin C change the way that niacinamide functions into more like a niacin, where it causes flushing and irritation? Can it just make them like less effective in general? But we do also have studies showing that they do work together. They can be used together, still be effective, and it really doesn't convert niacinamide to the more irritating version of itself under real world physiologic conditions. Because a lot of these studies were done where like the temperatures were too hot or too cold, like different temperatures that we really just don't function in as humans. And so the lab models don't mimic real life very well sometimes. So yes, they can be used together, and they can still be effective together. Let's see. So from Fadhail, can you speak Indonesian? I cannot. So my dad, he can speak Farsi or Persian, and my mom can speak Dutch. So I think her mom, she can speak Dutch. She's like Dutch Indonesian. And I can learn nothing. I didn't have like great work ethic as a kid. And of course they didn't speak it to each other in the home. And that's often the way it is. Like if both parents don't speak it and you don't speak it in the home, you lose it. And I lost it. I got nothing. Hi, Anna. Thank you. Anna Carr, amazing, jumped in. let's see here. I am not full Indonesian. I'm half Indonesian. My mom moved over from Indonesia, and my dad is not. He is, I think, English by descent, but he's just been American, white American. Uh, do, do, do. Reader of Speak said, "Can you and Dr. Shaw do a collab with Dr. Dre? That would be a powerhouse video." That would actually be awesome. We have such different personalities, though. It would be a very interesting video. I have so much respect for her, though. Just incredible knowledge, pioneer in the field, especially within dermatology and social media. A lot of respect for her. That I would love to do that. That'd be fun. All right. So from Aditi Singh, hello, doctor. Are peptides necessary in skincare for people who are under 30? I guess the key word here is necessary, right? So it depends on what your goals are. Of course, with peptides, you're mainly looking at like anti-aging and just healthy appearing skin. So they can be useful at any age. And same with retinol, same with like Botox. A lot of these things are preventative as well as treatment. So you would not be wrong to use peptides in your 30s and your 20s. Even though you haven't, I'm trying to remember the age. There's like a relative age. I think it's in our 20s where our whole body, our cells stop replicating and making like new cells, and we just start wearing out globally. Our whole body starts wearing out. And so it absolutely makes a lot of sense to use peptides in your 20s and 30s because it's going to have the same effects called boosting anti-aging. And it's going to offset some of our bodies just function as we start to physiologically wear out. Let's see here. Oh, Dr. Idris, that would be good. That would be a good collab. She, of course, is excellent. And yeah, that would be a lot of fun, actually. I would love to do that. I would love to do that. We actually were going to do one with James Welsh a while ago. It was pre-COVID. I don't know what happened to that. Love James. He is outstanding. Let's see here. Oh, this is a good one. So Jules Provins, how to choose a cleanser, basically. Cleansers, we've talked about this before too. Cleansers can be the cheapest, the least complicated step in your skincare routine. Especially if you're just getting started, there's no reason, I think, to expend a ton of energy and money in looking for a cleanser with a ton of actives, and that's pricey. The main goal of a cleanser is to clean off, reset the skin so that your targeted actives can work functionally and completely. It just like resets the skin in my mind. So if you're just starting out, or if a person's just starting out, I recommend just keeping it simple, keeping it cheap, like Vanicream facial cleanser. Perfect option. Like CeraVe, it makes excellent products. Their cleanser is super simple, not overstripping, and then it changes. So once you have your specific goals, like for example, if you have acne, then you want a cleanser with salicylic acid. You want a cleanser with glycolic acid. You could even use a tea tree oil cleanser. Those would all be great, And then I've seen this. So we Dr. Shaw and I, I'll tease this out. I don't know what we're gonna do with this. We went and did like a shop with me thing together at Walmart, and I made this like grocery game where there's all sorts of contingencies. Like we have a budget, you have to incorporate something from the grocery aisle, you have to shop in skincare aisle, whatever, number 15 in this case, you have to, whatever, all these different things. And it was really hard. And I noticed though, when we're going through, there's a lot of cleansers now that have very interesting actives in them. So just like the same actives you would have as your leave-on, like retinoids, they have a retinol cleanser now. And I'm not sure how effective that stuff is. I think salicylic acid is so lipophilic, it absorbs quickly. But sometimes I think using actives in a cleanser, you're rinsing them all off. So I wouldn't invest too much in your actives as a cleanser, but keep it simple. All right. Let's see here. Sneha Agarwal, is eczema avoidable and moisturizer? I thought I saw something else. And wait, and all under that, I mean, sure. Can you tell what I can use for eczema, please? And so this is the time of year when eczema just is going to flare. Like I guarantee, even though I do mostly procedures now, like surgical procedures, I guarantee when I do Gen Derm, I'm going to see mostly dry skin, itchy rashes, and eczema because uh, the humidity's down, even though not much. It's enough for people's skin to flip. And eczema is two-pronged, so you have to. So eczema and atopic dermatitis, like atopic dermatitis is very specific. It means something a bit different than just like an eczematous rash. But eczema, atopic dermatitis, there's like this inflammation, and this inflammation actually contributes to this dry skin itching, specifically the itch. It just drives it. And so you have to treat that. And this is where things like topical steroids and even oral steroids or anything anti-inflammatory, this can burst that down. Now we have, thank God, this medication called Dupixent, dupilumab. And this is one of the first medications in the space of eczema that targets very specific cellular signaling to knock out the itch. And it is a miracle for people with eczema and atopic dermatitis. Never had it before, but all of that treats the inflammation. And then once you burst down that inflammation, then you can switch it over and, well, not switch it over, you're going to use these at the same time, but use moisturizers. And this helps address that structural part of eczema and atopic dermatitis. Because with eczema and atopic dermatitis, you lack like filaggrin, which is a structural component of the skin. So you lose water to the environment just so quickly. And so things with ceramide, squalane, I mean, ceramides foundationally are the best, but also moisturizing ingredients like squalane as well. These help keep that skin barrier a little bit more intact to prevent that irritation and inflammation from restarting. So it's always a balance. Anti-inflammatories, moisturizers. Those are, that's kind of just a staple duo for eczema. And I'm trying to think here. I was really hard on Eczema Honey, the brand, for a while because there's not a lot studied actually for honey and eczema in particular. But other good brands, CeraVe, of course, is excellent. I really like the Lipocar AP. It's just so good. And Cetaphil has up their game. I'm really impressed with Cetaphil lately and the products they've put out. Their moisturizers are very good. Aveeno, that's one. That's really good. I love Aveeno moisturizer for eczema. It's a lighter vehicle, so especially I think it's useful for the face. But the oats, very well studied. I think oats are a great additive ingredient for people with eczema. Yep, Diana. George, can you talk about keloid treatments? So keloid treatments, keloids are those like thick, super crazy big scars. They can range from this small to just monstrously large and deforming, unfortunately. And what happens is they're just a scar, and then they secrete just too much growth factor, and they overgrow the original size of the wound. Now, as far as treatments, it depends on the area of the body, and it also depends on a person, just like how well they do with treatment. So let's say with keloids, you have one on your chest, you can inject it with a steroid that helps soften it up, can help it shrink down a little bit. That's kind of the foundational first line treatment. For ones on ears, we even use same thing, injections of steroids to use the anti-inflammatory effect, as well as use the actual side effect of atrophy to make that scar shrink. And that really does help. And then we also even use pressure bandages, especially on the earrings. Like you can excise it and put a little pressure earring on it rather, and it can help it from stopping to form. Let's see what else. We have injected other things like I think intralesional 5-FU, which is like a chemotherapy drug, but it also has a lot of other properties as well. You don't absorb much of it, and it might help as well. They can be really difficult to treat. It's really it can be really disheartening though, because you can even, let's say you just decide to cut the whole keloid out, it can come back in the same incision site. And we try to prevent that, again, by using pressure, by injecting steroid at the same time we excise. As far as over-the-counter, again, silicone really has become the gold standard for treating scars, including keloids. I think personally it's probably most effective when used early. So if you notice any scar or you have like a surgery and you're worried it's going to keloid, using a silicone sheet probably and silicone gel, those can help prevent the keloid from forming. And they have studied it and show that they can help actually soften and shrink mature scars as well. Let's see. Let's see. Okay, Lori Alred. or all red? Is there a minimum recommendation for SPF to be effective? For example, 30 versus 50? Yeah, in general. So like we recommend a 30. There was some other data published that said that people benefit from 50. And that was entirely based off the fact that we all collectively, like myself included, it's hard to put on enough sunscreen and use it as precisely as they do in the studies. So like that extra little tiny benefit from 50 over 30, it can be helpful. I think, again, the benefit as you step up from 30 to 50 is actually pretty small. So I recommend greater than 30. It really does blunt the majority of ultraviolet radiation. Robin, is a moisturizer essential for acne when you use Adapylene Epiduo? So Epiduo specifically is Adapylene combined with benzoyl peroxide. Excellent acne treatment, topical wise. Moisturizer, yes. So common misconception: people don't moisturize when they have acne because their face feels oily, or they're afraid that it might make their acne worse. But it's really foundationally and very important to use a moisturizer with your acne ingredients because they're all irritating. I mean, it's just the nature of what they do. And so using a moisturizer can help minimize the irritation, help keep the skin barrier intact and repaired, help your body repair it as well. And is honestly going to let you use your actives more effectively because you're not going to get irritated and try to shy away from them. So yeah, I think it's good to use moisturizer. And also, even if heavy moisturizers have made you break out before, if your acne is being treated well, you should be able to use any non-comedogenic moisturizer on the face without any problems. All right, and buried in the fireworks was, let's see, where was that? Can I use different cream on my face? Can I use different cream on my face as a retinol if I don't have acne? So basically the question is, can I use a retinoid if I don't have acne? And the answer is yes, right? Because we know retinoids, kind of like what I listed off in the pregnancy part, retinoids do so much. So they help dyspigmentation, hyperpigmentation, they treat collagen, they increase skin cell turnover, decrease oil production. They actually even have a little bit of a role in psoriasis. We use them for spot treatment for molluscum. We can use them for warts. And again, not super effective for some of these things, not like the most effective, but it just has so many different roles that absolutely a person can use retinoid on their face or wherever on their skin if they don't have acne. But again, it's not for everybody. It's not a staple treatment for other things like eczema. Not everyone with eczema can use a retinoid, and that's okay. So, but if your goals are aligned with one of those conditions I listed, then yes, a retinoid, you can use that as well. Let's see here. And Natalie, keratosis pilaris on the neck or the face, urea repair did not help at all. And that's, again, this is kind of like the pores discussion in my mind. Keratosis pilaris is absurdly difficult to treat for what it looks like under the microscope and what's causing it. It is twofold. It is like the little hair follicles getting plugged. And it's also a little bit of inflammation. And so urea creams, any exfoliant, chemical, physical, especially physical when we're talking about the body, these can help soften it up, right? Now, the other side is like the redness and inflammation, and incredibly and uniquely, retinoids are one of the few things in studies that have been shown to help with the redness. So I actually have a ton of exfoliating moisturizers laying around here. I'm just seeing if one is close to me. And it is not. But Dermatology, DRM TLGY actually has an exfoliating lotion. It's really lightweight, but it's just one example of many. I also like using you can use physical exfoliants here, or you can even use like the Skin Fix exfoliating pads for keratosis pilaris. It's just try to exfoliate. And again, it's going to help the texture. But the thing is, this is like how your skin is programmed to grow, believe it or not. And it's just a part of you in a way. And so every time you strip away the extra skin, anytime you get rid of the redness, anytime the skin is healing and trying to regrow, it tries to regrow in the same way. And I know that's very discouraging for a lot of people, but we've gone so far to use like laser hair removal or lasers to treat this. And even then it's not always 100%. So things can help, especially blunt it. Very rarely do I ever see it like completely go away, even with a lot of treatments. Including prescription. Okay, let's see here. Bricks, Pascal. All right, what skincare should I use? what skincare should I follow if I have psoriasis? Psoriasis is a very unique condition, very unique, and I think very misunderstood. Psoriasis is a combination, again, of inflammation, but it's the inflammation that actually drives the skin growth. Like it's very unique in that way. So even if we have things over the counter like the psoriasis creams with all salicylic acid, yes, salicylic acid can help soften skin. High strength salicylic acid can help exfoliate. However, all of that misses the thrust of the inflammation. So the most effective thing here, unfortunately, is prescription, because we need to decrease whole body inflammation. Psoriasis is actually a whole body condition. It causes arthritis. And actually, these people have an increased risk for like cardiovascular disease and metabolic syndrome because there's increased inflammation everywhere. Now, back to what can you use over the counter? Let's say a good moisturizing cream, not lotion, can help again soften it. I knocked on salicylic acid, but it can help as a mild exfoliant. It does soften it slightly. Urea, ammonium lactate all can help. In theory, you could also try. I know a lot of people physically exfoliate this because they're just trying to smooth it up. The problem there, and again, it's just under the microscope, is the blood vessels are really close to the surface. So even if you just lift off an individual scale of psoriasis, it often bleeds. Called the Auspitz sign, AUSPITZ. And so you do have this like kind of paradoxical thing where you have thick plaques, but the blood vessels are very close to the surface. So you may not be able to get it completely flat with the skin unless you treat it from the inside out, or use something like a topical steroid. Hydrocortisone over the counter can help treat the inflammation part. Use steroids always judiciously, 2 weeks maybe, and stop as a general rule, but I would coordinate that with your doctor, dermatologist. Let me just tell you though, the medications for psoriasis have like revolutionized the whole space in dermatology. Like every other dermatologic condition, eczema included, is chasing the psoriasis meds because the psoriasis meds are now so effective and are getting so incredibly safe because they've locked on to very specific parts of your immune system that are almost exclusively involved in treating in psoriasis. And so now, like you find a psoriasis medication that like barely touches the immune system at all globally, but very specifically knocks down the psoriasis part of the immune system that's hyperactive. So definitely, if you have psoriasis and it's something you struggle with, I would highly recommend you seeing a dermatologist because the medications for this condition are actually amazing, revolutionized from where they were 10, 15 years ago. All right, let's see. Probably have to hop off here soon. I'll try to do 3 more. I'll do 3 more. Do 3 more. I'm also disappointed because I don't know where my cup is with my sparkling water. That's like my favorite thing is sparkling water, and I don't know where it is. All right. Okay, let's do this one. Leandra, hello, hope you're doing well. Not working too hard. That's never the case. I, like Dr. Shaw, just always grinding. But do mineral sunscreens dry out your face more? My skin's already pretty dry and I live in a dry climate. So I grew up in Colorado, no humidity there at all. But if you think about what's in these mineral sunscreens, and let's use zinc oxide for our example, zinc oxide is actually also the foundational ingredient for butt paste and diaper rashes. Like it makes a great barrier. And so it doesn't necessarily dry it out. In fact, it can actually function as a very nice barrier to lock moisture in and keep irritants out. We use zinc oxide all the time for intertrigo and rashes involving irritation in areas of folds. So it should not dry out your skin more. It's extremely effective. And I love the idea sometimes of finding these like high-end sunscreens and doubling them as your moisturizer, because there's some really nice sunscreens now. Like I think we said in our other live, L70 UV Restore has just become my go-to. Oh, where'd that go? There it is. Okay. This is from Loco Levotic. Can argireline, I can't spell, that's what they said, but I agree, argireline is a hard word to spell. Can this cause sagging if you stop using it? Thank you. So argireline, Botox in a bottle. This ingredient is awesome, first of all. I love it. I actually have 3 forms of it right now, and I'm going to do an argireline video and giveaway on my Instagram soon because I want you to try it as well. I just love this ingredient. Now, it won't cause sagging. I'll just tell you that, because the way it works, let's say, even if it was as effective as Botox, which it's not, let's say it paralyzed your muscle, and you'd actually be more likely to sag while you're using it in theory, because so I have really heavy eyebrows. So when I get Botox, like, I have to be careful not to drop my eyebrow down, because when this muscle is paralyzed, these will naturally be at rest lower. So it's not that strong. It's not going to cause sagging while you use it. And then of course, when you stop it, it's definitely not going to cause sagging just by how it works. It's not going to cause anything if you stop it. Your face is just going to go back to what it was before you used it, which is fine. But you're just going to have a lot more movement back to varying degrees, depending on how well it works for you. All right, let's do hand cream, best ingredients from Mr. 1881. And there's no way that's your birthday. So one ingredient that's kind of underrated, I think, for hand and body is actually coconut oil. Again, I told you there's actually good studies, great studies, good or great, goodish, greatish studies on coconut oil as a moisturizer, how it works with wound healing, blah, blah, blah. But the one thing against it, the one knock on coconut oil, is it's comedogenic. So if you're someone who has acne and you put it on your face, it could make your acne worse. Not everybody, it won't do it for everybody, but it could. But it actually makes a great ingredient for body and hand or feet, whatever, anything but the head, skincare, as far as like moisturizing emollients go, moisturizing ingredients go. Also, I mean, again, especially with hands, like I go hard, go heavy with your moisturizer, like petrolatum. If you all have tried Vanacream's moisturizer, everything is just barely out of reach. If you ever tried Vanacream's moisturizer, which is over there, it is petrolatum based. And so it's very thick. You can just feel and appreciate the thickness of it. And it leaves like almost a protective, thicker film on your hands. And I love it for that. But then you contrast that to something else that's not petrolatum based. And these are just a lot lighter. So petrolatum, another great ingredient for the hands. You can even, if you have like the dry cracked hands where it's either like super scaly and cracked, you can benefit from something like urea where it moisturizes, as well as remove some of the extra skin as well, especially if your skin is cracked. I see a lot of that in derm. We see a lot of that. Just like people work hard. A lot of people are doing construction or fishermen or I mean, anything, gardening. Their hands get dry, cracked, fissures, split down the sides. I feel so bad for anyone who has that. It's miserable. But using things that can help remove those skin cells, soften them up, and then coming behind it with these heavy hitting moisturizing ingredients, great here. And otherwise, things that are heavily moisturizing, again, squalane, any oils, jojoba oil, not any oils, jojoba oil, squalane oil, those are great there as well. Ceramides, a must-have ingredient as well. Okay, let's see here. This is a good one. Can you, dang it, where'd it go? Can you do microneedling while have acne? Just call me Uma HH. And yes and no. So if you have inflammatory acne and it's red, inflamed, painful, I would recommend against it, because it's just so active and inflamed that any trauma to it could make it worse. It could make it just get revved up, all that inflammation flare, and it could make the acne worse. So I'd recommend using other methods to treat your acne before using something like microneedling. And then you can move on to procedural things like microneedling. I'd also do the same breadth for like heavier exfoliating or exfoliants or peels. I would get that inflammation calmed down first before I switch over to something that can be an irritating procedure. This one popped up before. Hi, doctor, can you prevent blind pimples? How are they treated? So blind pimples, those that have not reached the skin yet, they don't have a head. And these often can be the ones that scar. So they're deeper in the skin. They can be prevented by the same things that treat. And another reason retinoids are great. They gently exfoliate. They can prevent acne from forming as well as treat it after it's come on. So anything that's going to increase skin cell turnover, even glycolic acid, right, can do this as well. This can help prevent them from occurring. Especially though with these cystic lesions, a lot of times you have to switch over to the systemic medications to kind of really treat these from the inside out and get to a depth, because sometimes these form at the base of a hair follicle. Again, we see this under the microscope. They're really deep. Sometimes these acne lesions can be really deep, and topicals just can't get there even to prevent it from occurring. Oh no, I think I've done more than 3. I want to do one more though. Okay, one more. Sorry, and I know there's like a lot of good questions here, and like I said, we're going to try to do this very frequently. Like ideally, we envision this like once a week at least, like probably once a week. With a lot of stuff going on, but I would love to be doing this once a week. So my goal is to get all of these questions answered at some point. And so thank you all for being here. I'm going to get these answered. Let's see here. Where is that one? Where did that go? Okay, I wanted to. Sorry, I saw like a high. Whenever I see something like complicated medical derm, like super interests me because I love complicated medicine. I really do. But this question from Michelle Barrett: how can you tell the difference between lipoma and liposarcoma? Liposarcoma. So lipoma is just a benign fatty growth, lives under the skin. A lot of people have them. Very common. They feel like soft, rubbery. They're often kind of mobile, especially they're present on the trunk, the arms. You can get them on the head, forehead sometimes. And we surgically remove these. If you've ever watched Dr. Pimple Popper, I'm sure you've seen her remove hundreds of these. The only way to really know the difference between that and then this cancerous version of the fatty growth, which is very rare, by the way, so please do not freak out if you have what feels like a lipoma. Liposarcomas are extremely uncommon. And the only way to tell, though, is, we have to look at it under the microscope. I mean, that's just, again, such a foundational part of what we do. And then you can use different stains to distinguish, is this a liposarcoma versus a benign growth? But usually we can just tell by looking under the microscope if this is benign or not. Oh, okay. Sorry. All right. So this is the last one, I promise. But again, I love interacting with you all. I'm not sure we're going to do this in the middle of the day again, but works really well for me. Martina Fratzak. Are the fake tanning products safe for the skin, and can they contribute to skin aging? So most of the fake tanning products, including one made up of dihydroxyacetone, these are sugars. They're actually sugar-based, and so they're different than the sugars we consume, but they're sugar pretty naturally occurring in nature, and so they're fairly inert. They do cause a reaction in the skin that leads to what looks like tanning. And it's not real tanning in that it actually, one, provides very little to no sun blocking benefit. So even if you get extremely dark with self-tanner, you are going to have like an SPF of 5. It's not going to protect you from the sun. Now, do they themselves cause skin aging? The answer, I believe, is no. They don't actually directly age your skin yourself. I think the reason that a lot of people who self-tan do get a lot of photo aging is they just are doing it wrong, in that they are like getting a fake tan before they go on a trip to Jamaica, and then they just get crazy tan, like really tan, and get a lot of sun exposure there, thinking that it was protecting them, but it's not. Otherwise, these are actually very safe products, safe ingredients. All right, everybody. Thank you so much. I went a lot longer than I meant to, but I really love this. It's one of my favorite things to do. I'm glad we're going to be doing this more often. And yes, a cleave. I'm going to get to, I'll just start that next time. I'll start that next time. But I greatly appreciate you all, like genuinely appreciate everything. Love being a part of this with you. And if you haven't hopped over to our Dr. Lee Discord channel, I think we'll put a link down below. I'm not great with technology, but I'll try to put a link down below here as well. Just a community of people who love skincare. We talk, we answer questions, pop in. I mean, we're not the only ones answering questions. We have estheticians and other just skincare enthusiasts just talking amongst ourselves and each other. It's great. And you can hop over to our Instagram. My Instagram, put up stuff on that a lot too. And so I'll try to even ask some of these questions or answer some of these questions there. I do some Q&As on my Instagram more frequently as well. But appreciate you. Enjoy your week. 2 more days to the weekend, and that's all. So have a great one. Thank you.